Everyone. Welcome to our final LMCH Needs Assessment webinar. We're really delighted to have you on the line this afternoon. We'll be talking today about steps 7 and 8 of our needs assessment process, and look forward to hearing from you about how it's going and kind of your ideas for moving forward as well. So just to introduce who we have today. Trudy and Robin are here in the room with us. Carrie is on vacation, so she isn't here. This is Julia from MPHI, and Lauren is here in the room as well. And Erin is at another training, so she's not here, but our whole team has been really enjoying reading your last submissions and looking forward to some more submissions coming up tomorrow, I believe. All right, so today's agenda. We are going to check in on how the needs assessment process is going for you, answer any questions that you might have this afternoon as you're wrapping up your step 6. We're also going to provide some detailed guidance for step 7 and 8. We get into the exciting pieces around setting your goals and objectives and action planning for achieving those goals and objectives around the strategic issues that you prioritize in step 6. And then Trudy is going to talk a little bit about implementation monitoring and ongoing improvement, as well as the connection and alignment between the needs assessment process and product and the LMCH plan and work plan, to kind of have a sense of where this goes next once you've completed this needs assessment process. A couple additional notes to share at the end and some reminders, and of course have plenty of time for questions built in at the end as well as during the session. All right, so let's just take a quick reminder of where we've been and where we're going. We are right at the end of our needs assessment cycle. You've convened your partners, brought them together for visioning. You've gathered assessment information and data, looked at that data and decided what it meant. You've identified strategic issues that, if addressed, would improve maternal child and health in your community. And now we're at the point of looking at those strategic issues, setting goals and objectives around them, and developing plans to address those goals and objectives that you set for your community. As a reminder, the broad framework for our needs assessment process is the life course model. So we're thinking, at every point along the process of the connection between one phase of life and earlier phases of life, as well as how the life course is circular, what's happened to a parent has an influence on their children, and how that intergenerational health it is important to consider, as well as we think about both how to understand the data about health in the community and how to take action to improve health. The other major piece of our framework that we work from is this health pyramid, where we're thinking about how health outcomes are founded on behaviors, that the behaviors that we see are influenced by social determinants of health, as well as the direct and enabling services available within a community, and how our public health system creates a structure for delivering services in a good and effective way. So we're thinking about the assessment and now are planning for improvement around each of those levels. How do we get to health outcomes by improving the conditions in which a person makes their choices about health? We jump into our last couple steps in the needs assessment process. I'd like to check in on step 6. How is step 6 going for you, and what questions can we help answer today? Just 1 second, we'll unmute the lines. Good. I forgot my most important reminder of make sure that when you're speaking, your line is muted, and that if you get another call, to make sure that you don't put us on hold, because we can't do anything about the music if it starts playing. So you don't put us on hold, and do put us on mute when you're not speaking. But right now, everyone is off mute for the WebEx system. So any questions that you have, or any updates you have on step 6, please share.
Well, it's Jill, since nobody's talking. So this is Jill from Muskegon County. Yeah, I always talk. You know that. I wanted to say we've been really lucky to partner with the Great Start, the collaborative here. They've been a world of assistance. They have some skilled facilitators, and as you know, they network very well with parents and organizations and relationship to very, very, very people in our community. So they've been awesome. We've actually been able to do a lot of data gathering because we're working as partners. So we have our team that's working with their team, and so both of us are collecting information out there. So I'm expecting the best plan you ever saw.
That's wonderful.
Optimist.
Well, I can't wait to see it. So have you gotten to the point where you're beginning to kind of make sense of the data that you're gathering?
Absolutely. There is a historic plan here. So we actually had a base to be able to start with, which was helpful too, obviously, because we could see what we were able to accomplish and actually strike some things off the list and have a little bit easier time doing some prioritization. So
that feels good.
Yeah, no kidding. And, don't get me wrong, it's still a really long list. But I think we've been able to make some big strides in the past few years. So, so I'm excited to see what it ends up looking like in the end. And, of course, since it's, joint work and getting this done, it's to be joint objectives and those kinds of things. So,
that's
and
awesome.
strategies. So, we'll all be working from the same plan.
Wonderful. That is the goal, right? To have that sort of collective impact mentality, that idea that everyone working together, heading in the same direction, can make a much broad, deeper impact than agencies working independently. So that's really, really great. Thank you, Jill. Folks willing to share a little bit of their story or any questions that we can answer today? Oh, we will jump right into the content today, but please stop us at any time. If you have questions, there's always the chat box that you can type into, and Lauren is keeping her eye on that to make sure that we stop and answer any questions that might come through that mode. Okay, so step 7 of our process is around developing maternal and child health goals and objectives. So I'm going to start with some basic things that I think a lot of you are already super familiar with, defining what a goal is, defining what an objective is, and what a SMART objective is. But I'm going to spend a little bit more time talking today about what's hard about writing SMART objectives, because, all familiar with that idea and that language. It sounds simple when, someone like me stands up and talks about what it is and how it's defined, but it is not nearly as simple as it sounds when you kind of get down to the point putting pen to paper and thinking through with your partners, what can we measure and what is our baseline, and do we have anything that really links to this important goal that we want to accomplish, and the gaps between the goals and objectives and the way we're thinking about them. So I'm going to talk a little bit about that today, offer a couple strategies to hopefully make the process of writing objectives a little bit more streamlined, but I'm also really excited to hear from you about any ideas that you've come up with, tips that you've learned, tricks that you put into place to write objectives that are meaningful and important, as well as SMART as we've been asked to write them. So first of all, what is a goal? So we're asking you to write goals. We're asking you to make a broad statement of what you hope to achieve. So this doesn't have to be measurable. This doesn't have to be specific, and it can be, getting to that sort of line of being visionary. So it can be pretty broad, and it can be really forward-thinking. So our example here is, if your strategic issue is how can we reduce barriers to breastfeeding, you might write a goal like to ensure all women have the support they need to continue breastfeeding as long as they choose. So in the last step of the process, you asked yourself a question, the strategic issue, that you defined as being something that's really critical to achieve, to improve health in your community. And your goal is your first step in answering that question. So if we want to reduce barriers to breastfeeding, and we're asking ourselves the question, how can we reduce those barriers to breastfeeding? The first part of our answer is our goal of saying we want to set a goal of ensuring all women have the support they need to continue breastfeeding as long as they choose. Your step in answering that question is writing objectives. And I think that that's really the trickier part of this process. I think writing that goal, that's the part that feels good. It feels affirming. You can come up with that direction and kind of come to consensus around where you want to go. Writing an objective is trickier because when you write an objective, you are identifying a signal of improvement toward that goal, but it is never fully reflective of the goal itself. And I think that there's some cognitive dissonance that comes with, experiencing that, where you have this goal that is aspirational and exciting, and narrowing it to a specific measurable objective can feel a little bit confining, or like you're not really getting the full story. But I think that that's okay. And the way that I always think about objectives, talk about them, is that they are that signal that you're making progress towards your goal. They aren't the goal. Making progress on an objective is never the goal, but making progress on an objective should tell you that you are getting to that goal that you set for your community. So what's objective? An objective is a specific, measurable, achievable, relevant, and time-bound statement. So it's a SMART statement of what you hope to achieve by then, when. When you write an objective, you should always reference your baseline level of performance and your performance target in measurable terms. So when someone looks at your objectives, they should be able to see where you started and where you want to go, both of those pieces within your objective. So an example of that is if you have a goal to support breastfeeding in all settings where women live, work, and play, a signal that you're getting to that support feeding everywhere would be an objective like, by September 30th, 2019, increase the percentage of WIC clients who breastfeed at 6 months from 50% to 20%. So we're being specific about our clients, we're being specific about what we want to change, by when we want to see that change happen, we're saying where we are now and where we want to get to. But you can see that the objective here isn't perfectly aligned with the goal. But if we make progress on more WIC clients breastfeeding, that might be a signal to tell us that we are doing a better job in our community supporting breastfeeding in all settings where women live, work, and play. So these SMART criteria, let's dive in a little bit more deeply into what makes an objective SMART. We have this graphic here, and it kind of puts all of the information on one page, which is a helpful sort of point of reference if you want to flip back to this later. But our next several slides go through each of these in more criteria, so we'll go with that. First, S is specific. So your objectives should be clear and specific. And when you're thinking about how to write a specific objective, you should answer or try to answer each of the 5 W questions. What do you want to accomplish? Why is this objective important? Who is involved? Where is it located? And which resources or limits are involved? So a couple of these actually end up in the text of the objective, and a couple of them really don't. We'll say things like who's involved. You'll say such and health department, WIC clinic, something like that. You'll say what you want to accomplish. You want to increase, decrease a specific measure, particular time point, but you might not get to the why within your SMART criteria. But it's something that is cool to ask yourself. Why is this objective important? Why is this linked to our goal? What does it tell us if we see a change in this particular measure? And which resources or limits are involved? That might not be something you incorporate in the text of your objective, but it is something that is critical to think about when you're trying to be specific about what you want to change. You have to have that piece in mind of what are we investing to get this change? What strategies can you put in place? What do we have now that help us make this direction happen? So what's hard about this? Many things are hard about getting specific. As a big piece that is difficult is that oftentimes when you're writing objectives, you know the answers to all these questions. You're still in planning mode. And when you are encountering writing an objective and you're having a hard time being specific, it's usually a signal that there's this need to kind of go back and forth between what you're planning to do and why you're planning to do it and writing the objective. You know, we're talking about these things happening in order, these steps happening in order, but in reality, they kind of happen back and forth with one another. That you might get sitting down to write an objective that you want to be really specific about, but you have to really answer the question about where change is going to take place. So that piece of the specificity of your objective is missing, and it's a signal that there's a piece of planning that has to still happen in order to be ready to move forward with making this particular change. So the end of SMART is measurable. Simple objectives provide criteria for what it means to meet that objective, and a measure should tell you about how much or how many, how will I know that it's accomplished. One of the trickiest pieces of this, and most important, I think, is to be able to say what your baseline is for your measure within your objective, as well as how much you expect that baseline to change. One that I get a lot about measurable is, can you have a qualitative measure? And my answer to that is yes, you certainly can have a qualitative measure, and it's important as you're thinking about doing something qualitatively that you're pretty specific about what it's going to mean to gather that qualitative information, what that's going to look like, and how you can do that consistently from one time to another. It shouldn't kind of be a path around having a measure. It should be just as kind of rigorous and thought through a quantitative measure, but certainly you can have a qualitative measure. So what makes measurable hard? I think that what makes measurable hard is we don't ever have all the data that we want to really tell us about progress to goals. And sometimes the things that we really want to measure, we don't have a feasible way to get that type of data. It takes a lot of kind of thinking through what do we have available to us, what could we have at a reasonable cost within a reasonable time frame without creating too much burden, and that's what makes it really hard. I think sometimes the fallback is to go with what you can easily count, and that's where I think people start to kind of feel that inconsistency between what the measure is and what the objective is. So that's the space that gets really hard, is you want to get something that's telling you about progress toward your goal, but you have to kind of live within the limits of what you can measure. So that can be what's, I think, particularly challenging about getting to a measurable objective. Achievable is the A, or one of the options for what the A can be. Setting an achievable objective is important, while also making sure that you set an objective that is meaningful, that's maybe a little bit of a stretch from where you are. So one of the questions that is really common in thinking about what's achievable is, geez, how do I know how to set a target? So we'll talk about that in a little bit, but that can make this really difficult. Not being able to predict the future, not really being sure what you can achieve, makes it challenging to set an objective that's achievable. When thinking about that, I think that these are some helpful questions to consider. Do we have a strategy powerful enough to accomplish this objective? So if we set our target at a 50% increase, then do we have a strategy that can influence our situation or this health outcome to that extent? And do we have enough time to expect this particular change? Oftentimes when we're setting our time frames, they might be around a grant cycle, and sometimes with those grant cycles being maybe a year, it might not be possible to get to as large of a change as you want to get to ultimately within a particular time frame. So those things kind of have to work hand in hand. I also like to think of the A as standing for actionable. I think that in an ideal situation, objectives, especially when you're thinking about more process-oriented objectives, they can be really powerful sources of information for informing change or informing what you do next, figuring out how you could make improvements if you're not making progress toward that objective that you've set for yourself. Based on what you see under a particular objective, that should be informative to you to make some change. It should tell you, gosh, we're doing really great in this area, we're making really strong progress. Or it should tell you, we are making good progress, and I think this is something we could do about it. Okay, R stands for relevant. So your objectives should be related to what you want to accomplish. And a relevant goal can answer yes to questions like, is this really connected with our action? So as we think forward to what our plan is going to be for making change, is this measure really connected with those things we have planned? Is this the right time? Are we measuring things that we expect to change within the time frame of when those activities are planned? Is this matching other efforts or needs? Does this tell us about other things that are important within our setting? The right partners involved to reach this objective, and is it applicable within our current environment? And that last one, you know, as the environment that we're all working in shifts and changes, our measures sometimes need to adapt to those changes to make sure that they're still speaking to all the audiences that we hope to be able to speak to with the data that we collect and the objectives that we set. So I think that setting relevant objectives can be challenging because what's relevant for one purpose is sometimes not as relevant for another purpose or another purpose. So we might be setting relevant objectives that are relevant to our funder or a policy audience or a community audience or a client audience or within our own program or within our own agency that equally relevant to all of those parties. So kind of thinking through the balance of that, I think, makes this piece of having a SMART objective pretty tricky. So the end of the SMART, time bound. So objectives should be set around a time frame, indicating when you're going to meet that objective. And as you're thinking through that, again, this is where it becomes iterative between your action plan and your strategies and the objectives that you're setting. I think it often can make a lot of sense to think about, you know, what can I do by the end of the grant period? What can I do by 6 months? What can I do by 6 weeks? What can I do today? So that you're thinking about sort of series of changes that have to occur in order to get to the objective that you've set. That, again, what's tricky about this is sometimes there's this need to kind of go back and forth between what you have planned and what your objectives are to make sure alignment keeps making sense. It can be challenging to say by such and such a time we're going to have such and such a policy in place when you know there's a lot of dynamics that go into putting that policy into place. So it can be tricky to predict, and that's a challenge in setting a SMART objective. So I've talked a lot about challenges, and so now I'm going to shift to talking a little bit about some of the tricks that we use here to help us set SMART objectives, because again, something that sounds simple, but in reality is pretty challenging to pull off. Some of the tricks that we use is we use a template to make sure that we're covering all of our bases. So this is a template for writing objectives that we've used for a wide variety of things, where in the first column we're saying by date, when are we going to accomplish this by? So we're getting that time-bound piece. Who will increase or decrease whatever you're measuring from your baseline value to your target value. So we're covering kind of each of our pieces of having a SMART objective within the different columns of the table. So the example here, our by date is by 9/30/17. Our who is the Washington County Health Department. Fun fact, Washington County is the most frequent county in the United States. That's why we use it oftentimes. But anyway, so the Washington County Health Department will, we have to select how is it going to change, increase in this case, and what are we going to measure? We're going to measure the percent of adolescents in age 13 to 18 who have completed one or more doses of the HPV vaccine from what is our baseline value, 18%, to our target value, 28%. So this is just a strategy for making sure you kind of cover your bases. And when you get to a piece of this where you don't know the answer, you don't know what to put in the column, again, that's a signal for planning. It's a signal to say, okay, we need to kind of go back to what do we have in mind that we're going to do? What data do we have available around this topic? What data led us to select this as an issue in the first place? That can be a good source to kind of gather that information and put that piece in place. But it's a way to kind of make sure you cover your bases, as well as a way to give you an idea of if you need to do a little bit more planning so that you can put something in each of these columns that makes sense. Other tip that we use is we avoid like the plague using language that indicates a percent change or a percentage point change, because it gets so confusing. What do you really mean? We really try to use language where we're referencing both the baseline and the target within the objective, rather than saying we're going to change by X percent. So this example kind of illustrates why we do that. So in our first row there, we're saying by 9/30/17, the Washington County Health Department will increase the percent of MIHP clients screened for depression by 15%. So some folks might interpret that as meaning from your baseline, you're going to add 15 percentage points to that baseline to get to your target. However, technically that's probably not the most accurate interpretation of the words, that this is indicating that what you're looking for is a percent change. So it's the percent of the baseline that you expect to increase, and you can kind of see the math in the next couple columns. So this measure doesn't tell you what the baseline is, which can signal that maybe the baseline isn't clear or known, which is also another challenge or problem. So let's imagine in this case the baseline is 60%. A percent change would be 15% of 60. So the target would be calculated out at 69%. So if you look at the second one, by 9/30/17, the Washington County Health Department will increase the percent of MIHP clients screened for depression by 15 percentage points. That would be the more accurate way of getting that idea of adding 50 to the baseline number. So in this case, if the baseline is 60%, adding 15 percentage points to that would get you to a 75% target. But that ambiguity in that language leads to pretty different targets. And so being able to be really clear can be helpful to any audience as well as internally. I can say that we have made this mistake in writing grant applications and gotten to the point where we needed to report the data and said, oh my goodness, we are actually not sure what we meant when we wrote this objective. So if you can be specific and clear about your baseline and your target, it just kind of gets everyone on the same page. So that's the last example here. The Washington County Health Department will increase the percent of MIHP clients screened for depression from 60% to 75%. And so the great thing about that is no math is needed. We know exactly where we are now and exactly where we're going. And I'm going to pause here and unmute the lines because I know that this can really be a point of confusion. I'm not sure how clearly I said that. So if there are any questions, please let me know. I can clarify that difference between a percent change and a percentage point change.
Hi, Danielle here from Van Buren Cass Health Department. How are you?
How are you, Danielle?
Good. I have a quick question about baseline. And
yes.
Maybe I'm just jumping ahead, and instead this wouldn't be an objective, but rather a strategy within that. We had, because of our geographical region, we did have a handful of missing data. So under some of our strategic issues, which then I assume will be some goals, we had talked about needing to gather that data ourselves. So, for example, we have a good understanding of the specifically sexual health education within our school system area, because we just don't, and everybody kind of is doing their own thing, if any. And so we believe that we need to implement preventive education because of other reasons, when, key findings that led us to a theme. But if we were to write an objective, we would not have a baseline to go off of. So I wouldn't necessarily do a percentage of increasing, adolescents' knowledge and/or towards behavior change increase, but could still write an objective that was just a flat number. So, for example, we will increase from 0 to 19 schools, X, Y, Z, et cetera, et cetera. Does that make sense what I'm asking?
Yeah, I think that you're pointing out one of the really common challenges around setting objectives. We don't have the data that you would like to have to really get close to the activity that you're planning to implement. When folks don't have the data they need to set the objective they want to set, I think gathering data and being able to establish a baseline as an activity within a plan, and would recommend kind of thinking about it in that way.
Okay.
There's probably other data that you have on hand that kind of led you to having a concern about adolescent sexual education.
Yeah, exactly.
So it might be possible to say, okay, we have this broader outcome objective of we want to reduce teen pregnancy within our service area by X percent, from X percent to X percent within some time frame, and then plan on building objectives under that are telling you if you're making progress once you have that baseline data available. If you have an objective like you want your 19 schools to report into some system, I think that it is totally fine to say set an objective around, right, have 0 schools reporting, we want to have 19 schools reporting by X time. I think that's a good objective to set as well. I think that the cautionary piece that I usually put out there is around setting an objective when you don't have a baseline to go off of at all, that
right.
It can be it'd be really hard to use it in a meaningful way.
Right.
But not having the data you need is a gap, and so I think having an action plan step around, we want to have these data available, and so we have a plan in place to collect those data for our community, I think is great.
Oh, that makes sense.
Does that help?
Yeah, absolutely.
Absolutely.
I think that's interesting about using the data in a meaningful way, and it's difficult when you don't have a baseline, is some people have said that they're going to have like 100% of their clients are going to do whatever, and then that's one of the requirements of the program that you would do particular activity as well. And that also does a lot of meaning because that's part of your implementation plan, that everybody's going to do depression screening in your program or whatever it is. And then if you're saying that you're going to try to reach 100%, but you don't really know how many people were baseline, it makes it be very difficult to see how you're achieving those objectives as you move forward. Mm-hmm. So those are some of those really tricky things that you get as you're trying to set up objectives.
Yeah, it sounds so easy, and it's really just not. It's tricky. Any other questions about the percent change or this particular piece? Again, I know it's confusing, and I don't know if I explained it well. We'll move on to the next trick. So this, again, is where there's this back and forth that happens between coming up with strategies and setting objectives. You can think about your midterm objectives as something that's a little bit further out because there was something in your data that triggered you to look at a particular issue. So you might be able to start setting your midterm objectives before you have a good idea about your strategies, maybe. However, as you get to objectives that are more short-term or more around your strategies, there is that real need to kind of go back and forth between what are we trying to accomplish exactly and what is it that we're doing that will lead us to accomplish that. At the end of the day, I think it can be super helpful to have objectives that are telling you something about the path from the strategy you're putting in place to the outcomes that you're hoping to achieve. And so this is kind of an illustration of how that might work. So we had this goal example that we brought up earlier of to support all women in breastfeeding as long as they choose. So that's our goal. Maybe one of our strategies is that we want to support pregnant and parenting clients in enrolling in both a home visiting program and a WIC program. We think that dual enrollment will be really supportive for women. We know now there's some disconnect between the two programs with the community or within our health department, and we think we can kind of tie those pieces together a little bit more closely, and we think that will help us get closer to our goal around supporting women in breastfeeding. So the path of objectives here, what I kind of want to bring your attention to. So the first thing you might want to look at is something that's really close to your strategy. So by 9/30/18, increase the percent of eligible health department clients who are enrolled in both a home visiting program and WIC from 45% to 70%. So we know where we are now. 45% are enrolled in both programs. We can get within a year to 70% being enrolled in both programs. And we think that if that happens, then health department clients will have better access to lactation support. That's the short-term outcome we're trying to get to. And so we can have an objective that's connect that short-term idea of what we want to accomplish. And that's what you see in the next column. By 9/30/18, increase the percent of health department clients who give birth that meet with a lactation consultant in the 6 weeks after baby is born from 15% to 30%. So we're, again, seeing of our clientele as this group of women who are in WIC or home visiting program or both. And we know that we have relatively few that are meeting with a lactation consultant, but we think that being connected with both these programs will increase the chance that that happens. And that's kind of our logic, and this is our way of testing, is that logic playing out in the way that we hope that it will. The thing that we might hope would happen is that health department clients have the support they need to breastfeed their babies. And so we measure that around 8% of WIC, NFP and MIHP clients who breastfeed to 6 months from 5% to 20%. So what I urge you to do is think back and forth, again, between the strategies that you're implementing and the goal that you're hoping to achieve, and think about that logic. What's the connection between strategy and your goal, and how can you kind of build your objectives for measuring what you're implementing to make sure that's happening, to measuring what you think will happen in the short and midterm to make sure that those things are happening, to, again, help you understand, are you making the progress that you expect to toward that broader goal that you hope to achieve for your community. Just a couple more of these tips and tricks. So population-level measures require strategies that are designed to have a population-level impact. Again, this speaks to that relationship between strategy and setting your measures and your objectives. And I think one of the things that makes folks really nervous in setting objectives is setting objectives that are around a change in population-level health statistic, like the percent of babies that are born premature within a county, and the types of things that you can do as a health department. You might have a strategy that is designed to make a population-level change where an objective that is a population-level health measure is totally appropriate. However, if you have a strategy that is reaching a relatively small number of people or clients of a specific program, you might want to set an objective and identify a measure that's more specific to that particular group of people that you're serving. So here is an illustration of aligning your strategy with your measure. So if you have a strategy of making sure that WIC clients are up to date on immunization, so you're specifically looking at the immunization records of clients that come into the WIC clinic, seeing are they up to date. If they're not up to date, then you're doing a warm handoff to your immunization clinic, and that's kind of your strategy. You wouldn't necessarily expect that unless you have a huge WIC program that's serving, most of the population of your community. You wouldn't necessarily expect that strategy would have an impact on your immunization rates at a county or multi-county level, but you would certainly expect it to have an impact on the rates, immunization rates for your WIC clients. So that would be what you might want to focus on measuring. However, if your strategy is to have a huge multi-level community-wide information campaign, so you have billboards and you have radio spots and you've worked with providers on handing out information about immunizations, and you have folks going to schools and parent organizations and libraries, and they are talking about immunization safety and the importance of immunizations. If you have a big effort like that that really is intended to reach most people within your target audience within your community, then you might expect to see a population level change, and looking at that immunization rate at the county level, multi-county level, might be fully appropriate. So again, it's just that dance between what are we doing and what can we reasonably expect to happen because of it. And I think it also allows groups to kind of test themselves. Like, if what we really want to do is increase the percent of kids that are fully immunized by their 5th birthday, what strategies do we need to put in place that are powerful enough to see that change, or what series of strategies do we need to put in place that are powerful enough to see that change? So I think that thinking goes in both directions. So again, one of the challenges with setting a objective is around this measurement piece. And it is absolutely important to be realistic about what you can measure and what you can't. But I really encourage you to be creative in your thinking around that. And there's lots of innovative, interesting ways that you've already been testing through this needs assessment process to get at data that you might not have readily available through a population health survey or within your health records, for example. And the first question that I would always encourage you to ask yourself is this information that we could get by asking the people that we serve? Is there a way that, through the providers that are in our network, we could just kind of routinely check in with clients on this particular issue, and it would give us some information to go off of and put a measure in place that helps us get at this gap in data that we have available. I think this is the last step. It is the last step. Okay. Is around use resources to set your targets, but don't stress over. I think that this is one of the most common questions that we get when we're talking with folks about setting objectives is, how do I know what target to set? And it can be a source of concern because you want to make sure that you're setting a target that's really something that you can do and is reasonable to expect. And at the same time, you don't want to set it too low. You don't want to set the bar too low for your program or for your community or your partnership. You want to set it at the right place. So a couple things to think about. Look at neighbors, see where their performance is, and see if that gives you some kind of ideas or guidance about what might be a reasonable place to set a particular target. You can also look at state or national targets. I am a very frequent user of Healthy People 2020 to try to get a sense of, as a nation, where do we want to be, where do we want to go? What's the distance between where we want to go and where we are now at a national level? And how does that inform where we are locally or for Michigan? I use that as a resource a lot, as well as where Michigan is or where counties or sister states are to Michigan, to kind of get an idea of what might be feasible for similar thing. Another resource to use to set your target is thinking about your denominator, and I think this is particularly relevant, especially relevant when you're setting targets that are related to a particular group of people that you're serving. So if you're talking about your MIHP clients, it can be really helpful to think about how many clients are we serving now that would be in the denominator of this measure. So if it is the percent of clients that are screened for depression that have positive depression screening that are connected with services. So we want to get women with a positive screening connected to services. How many women are screening positive for depression right now? That can give you a sense of how much of a change you can expect to see in that from where you are at baseline to where you want to go on kind of the size of the denominator. And I think that perhaps the most important one to think about is what would be an appropriate level of service or performance? What would be a level to set that you would feel proud of for your community? What's that immunization rate that you feel, gosh, if we got there, that would really be an accomplishment? What feels like an appropriate level of service or an appropriate level of performance? Okay, any questions about any of those tips or tricks or other questions that you have about setting objectives? You sit down to do it, that it really gets tough. So as you get to that point in this process for yourself, reach out to us, and we will definitely support you as you're thinking through what you can learn, how to articulate it in terms of an objective.
So what I would add is that Robin and I noticed as we were looking at people's objectives and what kind of activities that they were doing, we've come back and said, is this a realistic objective? Are you really going to be able to move the needle that much from the baseline? Because our one-year cycle, and so talking about moving the needle in a one-year time frame, and we want people to be when they with the year instead of saying, oh, I didn't meet that objective, I didn't meet that objective, I didn't meet that objective. Our engages on a one-year time frame might to make a smaller objective, a smaller measurement from baseline to whatever your target is, and achieve that, than to make this big objective that you might not be able to attain for 5 years. So just keep those kinds of things in mind as well when your objective.
Thank you. Oh, so you are all unmuted, and we're hoping you'll engage with us in a couple activities here. So on kind of what we've been talking about and thinking through, we have a couple of objectives that we're hoping that you can help us improve. So if you saw an objective like, we will improve the number of hearing tests given by the health department, would you consider that SMART? And if not, what gaps do you see?
Measurable.
It's not measurable. More about that. What would make it more measurable?
They have a baseline and the actual description, what they wanted to increase by or improve by. The number.
Awesome. Yeah, exactly. Awesome. What did you do to make it more SMART?
I put more time frame into it, like by a certain date. You'll have results.
Perfect. If you know who we and health department are, but in looking at it, I don't.
That's right.
The thing that I think about with this one is,
I'm going to say I don't know if improve is the right act there. Maybe it's because what are we improving the number? Maybe to be increasing the number.
Yeah, I like that. Yep, excellent.
Yes, Jill, it's not very specific at all. It doesn't say improve by how much, and of course it's not even gotten to the point where, you know, whether or not it's achievable, because if you said we're going to screen a single child in Miss County for hearing and screening, we may not ever be able to do that. So you've got to really watch your numbers and where you even go with that. And it doesn't say we're going to do it by, it's just a really, really bad statement.
It's just not working, is it?
Not at all. Don't tell me anything.
The other thing I noticed about this one is, does the health department give everyone a hearing test?
Oh, they actually do hearing screenings. So that's just like wrong.
Oh.
Oh.
Young kids.
What's that? I noticed.
Oh, go ahead.
I am like seriously hearing my echo there, aren't I? One of the things that I noticed about the language hearing test is that there be some populations that the health department screens and others that they don't do hearing screens for.
That's true.
And that might be another way to make it a little bit more specific.
Yeah.
And then improving the hearing screen, are they improving the amount of people that they see? I don't know. It's just bad.
It's just a bad one.
Just scratch it out, yeah.
Well, we have one on the next page that we tried to improve a bit. So this one reads, by 9/30/18, the Washington County Health Department will increase the number of hearing tests, and Jill, thank you, this should be hearing screens for children aged 3 to 18 completed monthly at the department and in school settings from 345 in fiscal year 2016 to 600 in fiscal year 2018. And we already found an error with that one, that we're saying test instead of screen. Anything else that you notice still in this one where you're like, that's not really specific enough or measurable enough or achievable enough, relevant enough, or time-bound enough?
Well, again, you're looking at doubling your numbers, which if your department is anything like ours, we're not going to increase any more staff, so you're asking your staff to do twice as many screens.
Perfect. So we have that question here about, is this really achievable given the capacity that we have? And notice that we won't have more capacity, so why would we be able to do twice as much as we are now? All right, let's look at another one. By 9/30/18, the Washington County Health Department, our favorite health department, will increase the number of individuals who attend the parenting education classes by 50%. His goal, is this objective specific, measurable, achievable, relevant, and time-bound?
This is Andrea from Mid-Michigan, and one thing I see on here is that this statement utilizes a percentage, which is what we talked about earlier, that we really shouldn't do that.
Absolutely.
Okay.
Yeah, I'd be more clear about what they're trying to change if they said how their baseline number of participants at parenting classes and their target number of participants at parenting classes. It's hard for me to interpret what they mean by increasing the number of individuals who attend by 50%.
Right. Okay.
Yeah, exactly. You notice.
In Washington, not Washington, and I just wonder how we would be defining attend the parent education classes. So whose classes and what constitutes attendance? Is it one time? Is it attending a series, including some sort of completion of a course? So just how to define that.
Perfect. I think that's an excellent question. Is there anything you notice in this one? I read about the who piece, the number of individuals. Which individuals do attend parenting classes? We have another example of this same one on the next page, and with some improvements and probably still some gaps. Ooh, trip my tongue. By 9/30/18, the Washington County Health Department will increase the number of teen fathers who attend parenting education classes offered by the department from an average of 2 per class to an average of 3 per class. How would you make that one more smart?
You have to include the average of 2 class. Couldn't you just say we want to increase to 3 per class? The average.
Well, that's an interesting observation. I think that it's a key thing when you want to increase attendance because of a couple things. The baseline kind of a moving target, right? So you might have 3 in class, 1 in another class, 4 in class, 6 at the next class, 0 next class. So it's kind of always moving up and down. So that would be one reason to go for an average, is to say, you know, to look at our past 10 classes that we did, how many were in each of those 10 classes, and to come up with the average. So for our next 10 classes, what would be the average for that next set of classes? But that piece of it isn't very clear when you read the language, you know, all of that calculation pieces. So I think that you're pointing out that it could be more measurable than it is and more specific than it is by, you know, giving a little bit more context about average of what.
Yeah. Thank you.
Any other observations on this one? Okay,
No, I wouldn't ever use attending a parenting education class as a measure. I really want to look at really what they obtained out of it. As they show up doesn't mean anything to me. So I'd be actually looking at, say, an increase in knowledge, you know, in the pre and post test and those kinds of things.
So saying that you're thinking that this isn't a particularly relevant measure. Just being there doesn't tell you very much about what your progress is towards your goals.
Right.
Excellent. You guys are doing so awesome. Let's look at the next one, audience activity 2. I'm wondering if you can tell me which of the SMART criteria you think are addressed by each objective, if any. So here we have, we will increase the immunization rate for children. Which of the SMART criteria are and aren't addressed by that?
There isn't any specific, being specific there on the date and things like that, and then how much.
We're not getting to the S. What else?
Measurable.
Measurable. Because the immunization rate, but the immunization rate, there can be a variety of types of immunizations. The immunization schedule is specific to children of particular ages. There's lots of complexities with the immunization rate that we don't know about by that language, right?
Time boundaries.
There's no boundary, yep. Is it relevant? Yeah, for sure.
It is.
You want to increase the immunization rate, so it's relevant. It's probably not specific, measurable. We don't know if it's achievable because it's not specific, and it's not time-bound, but it's probably relevant. How about the second one? Increase the immunization rates for children from 19 to 36 months by the end of fiscal year 2018. What do we have covered here? It's time, yep. It's relevant, yep.
But they are missing to my eye.
Yep. Tell me more about why the SNA are missing.
Oh, it's not specific because you don't know if it's like the fourth, which sort of, like you were saying, what immunizations are we considering there, like including FA or not. It's a from or to.
Yep.
And so then we really know if it's achievable if for going from 62% to 100%. We don't know if that wouldn't be achievable, but we don't know. I guess it's for the whole children in all of their jurisdiction, or maybe it's for a subset of children. I'm not sure about that either.
Exactly. Perfect. How about this next one? By September 30th, 2018, increased linkage of prenatal women to dental care from X to Y. So tempting, but probably not a good plan, right? Does it have covered? Yep. What's it missing? What would you like to see incorporated into this one?
The activity.
Yep, boo.
Link it prenatal women to dental care really means if we're looking for pregnant women to have a preventive dental visit or like that. I'm not really sure. Maybe that's verbiage that's beyond that.
I think that the verbiage that you use is much more specific than this language. I agree. I'm not real sure what that means, to link prenatal women to dental care. Our last one. In 6 months, 95% of all health department educational materials will be available in Spanish. What do you see as SMART criteria that are covered, and how would you improve this?
I work in the education department. I tell you, there's a lot of educational material. So I'm not so sure it's achievable.
Might not be achievable. And with that background working in the education department, can you imagine the process for setting a baseline for this?
I don't even know if I could do that. Yeah, honestly, I don't think I could. Like, it'd be like the whole entire website, everything that we ever put on Facebook, everything that's printed. No, it's not going to happen, Julia.
I think that's reasonable. Anything else that you notice about this that you think could be improved?
Down is it's hard to know, like, when does the 6 months start. So I'd rather by a certain date.
Me too.
Yeah.
So awesome. Thank you, everyone, for participating in those activities and giving us a little bit of a chance to look at some perspectives and think about how they might be strengthened and improved. I have had so many experiences where I have myself written objectives and then, like I said, gone back and needed to report on them and really question, what was I thinking when I did that? There's always opportunity to kind of reflect and improve, clarify, strengthen objectives. Again, activity that sounds like it's simple, but when you get down to doing it, it's really challenging, and not doing that kind of critical thinking about up front just pay off in the long run when you get to the point of needing to report on where you were and where you've come. So again, thanks for hanging in there through those activities, and as you get to the point of setting objectives, reach out to us because we are more than happy to help you think through it because it's real challenging. Okay, so how does this all link back to completing the tool and going through the needs assessment process? So what the tool will ask you to do is, well, you'll have your strategic issues that you prioritized, and for each of those, we'll ask you to set a goal and at least one objective. You might want more than one objective, but for the purposes of this, we're only asking you to do one. oftentimes one objective doesn't give you the full picture. It doesn't allow you to do like a process and a more outcome-oriented objective, and you might want to build off of that idea of doing just one. What we're going to ask you to do is create objectives that are thinking about what might signal progress towards your goal and addressing your strategic issues. So again, your objective doesn't have to be fully reflective of everything that's in your broader goal. Your goal, again, can be more visionary, but it's just a signal. It tells you that you're making some progress toward that goal for your community. We'd really encourage you, again, to engage your partners in the process in a way that makes good sense for your group. We have this in a variety of ways. We have had group sessions where we sit down and have kind of a facilitated conversation around setting goals and objectives. For some groups that can feel a little tedious, you can get lost a little bit in the language and maybe go down the unfortunate wordsmithing path. So sometimes for some groups it makes a lot of sense to have a session where you're gathering ideas about what the goals might look like, what objectives might look like, where it's really more brainstorming than it is refining, but then taking that group brainstorming process and turning that into goal statements, objective statements that you then share back with the broader group. You might also have a group that's comfortable with one or a couple people taking the lead on developing goals and objectives and then bringing that back to the broader group. So there's a variety of ways to do this, and I think that you all have really great judgment about the best ways to engage the groups of partners that you're connected with. So these are just a couple ideas of things that we've tried that we think can work. Do this collaboratively. So in the tool itself, what you'll fill in is Table 13, and this will look really familiar based on one of the tips that I gave just a little bit ago. What you'll do in the first column of Table 13 is you'll include your strategic issue. Next to strategic issue, you'll enter a goal. And next to that goal, you'll enter your objective, and you'll use that kind of format that I illustrated in that tip and trick. So you'll say by what date, who's going to do what are they going to increase, what measure are you going to use, what's your baseline, and what's your target. And again, when you get to this piece of it, we're more than happy to help fill that in and help you work within the context of that kind of structure and table. So I want to take a pause here as we're getting through this step and have a chance to share a little bit. What's your experience writing SMART goals and objectives, and do you have any tips or tricks that you could share with your colleagues?
This is Jill again. You know, sometimes I get caught up in my own jargon. So it's very, very, very understandable to me. But when I take it out to like outside organizations, they look at it and they go, "What are you talking about?" So you have to let other folks take a look at it and make sure that it's understandable to them.
That's a really good suggestion. Just getting some other feedback on is this clear and specific to you can be really helpful. We have our own language for everything, don't we?
Sure we do.
Lil in Washtenaw again. I found it helpful in the past to document clearly in like a form that's separate from where you're listing your goals and objectives, what the numerator is going to be for, you know, you're calculating some sort of measure. What's the denominator going to be? How are the data retrieved for reporting and like that, you know, how the data collected so that you can measure it the same way each time, have a plan for looking at it quarterly or biannually or whatever it is. That's been useful for us.
That is super helpful, Lily. Thank you for that suggestion of really making sure you take the step of thinking through that measure at a good level of specificity where you're saying what the numerator and denominator is, you're saying what the data source is, maybe you're thinking about the timing of data collection for that measure so that you have that good alignment between what's in your objective and the data that you'll have available. And as you said, you have a way to make sure it's done consistently each time. And tips or tricks? Well, thank you. Those were great. Let's talk a little bit about step 8, identifying strategies and developing an action plan. So last step of the process, and this is where we're really starting to think about what are we going to do? What actions are we going to take? Again, I would encourage you to think about steps 7 and 8 as kind of a cycle back and forth to one other versus a straight line, and probably more accurate to think of that way because there is that need to interact between what you're measuring and what you're doing and making sure that those continue to be in alignment. I always start with the measurement piece of it because I want you to think first about what you want to achieve before you start thinking about what your strategy should be to achieve that objective. But again, once you know what you're doing, then you can be clearer and more specific about how to measure progress toward a broader goal. Okay, so in step 8, you'll identify how you're going to achieve each goal that you identified in step 7. So if you imagine the table I just showed, you have your strategic issue, you have your goal, you have your objective, or maybe your objectives. And this is the piece of the process where you're translating, okay, this is what we want to do, and this is what we're going to do in order to get there. This is what we want to achieve, this is what we're going to do in order to achieve that. What I'd really encourage you to do is carefully consider and think through the strategies that have the greatest impact on addressing your strategic issues and achieving your goals based on the public health pyramid. So we referenced back to the public health pyramid at the beginning of this session today, and this is another place where this idea becomes particularly important in the needs assessment process. So we know that there are actions we can take at each level of the pyramid that have a different ability to have broad impact on community health. The further you get down the pyramid, typically the broader your impact can be. So as you're thinking about strategies, think about the strategies you can put in place that will have the broadest impact on your community and on the health outcomes that you're targeting. Of course, I'd also encourage you to think about how outcomes at one phase of life are influenced by earlier phases of life or are intergenerationally influenced. I'd also, of course, encourage you to think about strategies that are evidence-based. However, I know that there's gaps in the evidence base. The evidence base is imperfect. There's definitely strategies that have a good evidence base, but they don't have a good evidence base for the population that you're serving. So that link is maybe a little bit weaker, and maybe that strategy doesn't make sense in your community or with the populations that you're working with. Or maybe you have heard about something that's fairly innovative and new, and there hasn't been time to generate an evidence base around it, but instead it has kind of some theories and some other evidence that link to it that suggests it might work and might be worth trying. So while I would definitely encourage you to look to evidence-based strategies to impact community health, I don't think that that's a big brick wall between what you can do and can't do, but just something to be thoughtful about and conscientious about as you're planning. So back to the pyramid. To kind of illustrate again the different levels of intervention that you might think about as you're making plans to achieve a health change within your community. So this example here is around smoking and reducing prenatal smoking specifically. So at the individual level, you might use a strategy like using the 5 A's intervention with family planning clients and during home visits. So at the individual level, you can introduce an evidence-based program or strategy to make individual level behavior change to support prenatal clients that you serve in quitting using tobacco. You could always tackle, or you could also tackle this same issue of prenatal smoking at kind of a broader level by maybe expanding the number of prenatal care providers that are trained in smoking cessation techniques and resources. So instead of just reaching just the clients that you serve at health department, maybe by tap into providers across your community that serve prenatal clients, training them in intervention strategies. Perhaps you can have a broader reach on a broader group of women who might be smoking during pregnancy. At the next level, you might look at things that have a broad community level impact, like strengthening and improving enforcement of clean air laws, so you're kind of reducing smoking and exposure to tobacco smoke for your community in general. So I think sometimes the pyramid suggests this is better than that sort of way of thinking. I would encourage you to think of it as an additive, mutually reinforcing set of strategies that aren't targeting only one level, but are thinking about how you can build a comprehensive strategies that touch each level and hopefully have the greatest impact, because you're thinking about what can I do for the person in front of me, what can I do for our service system or within our community setting to make changes, and then what can I do at a broader policy infrastructure sort of level to change the way our community works in a way that would impact everyone in a positive way. So as you are identifying strategies, is your first step to really just be brainstorming. We want you to sit down with your partners and think about, okay, we have this goal, we have this objective. What are some of the things that we could do to get there? What have you heard about? What have you seen tested in other places? What have you been exposed to? You can also, of course, search the literature. That can be the academic literature, but it can also be kind of a Google sort of search. There's, the Robert Wood Johnson Foundation, lots of places put out fantastic information about intervention strategies that are innovative, that have been tested. Might be early in their testing, but that are really intriguing, interesting ideas, and you can kind of expand your brainstorming list by doing some of that searching and reading. The other thing I have in here is ask friends. We have such a wealth of knowledge and expertise across our public health system in Michigan, and I'm always amazed, as I sit down and talk with public health professionals or professionals within the broader public health system of what they know, what they've heard about, been exposed to, the webinar that they were on last week, or the book that they're reading, or the thing that they heard about at a conference. So I really encourage you to, as you're thinking through this, as you're planning for this, reach out to your colleagues, and or if you happen to be around someone, just ask them what they've heard about, what they know about. That can be a way to generate some ideas. So at this point in the process, you'll be identifying strategies that you can implement, strategies you can't implement, strategies that might have community support, not have community support. The idea isn't to be exclusive about it. The idea is to be very inclusive and broad and get to a nice, healthy, broad list of potential strategies. And in this example here on this slide is illustrating how to think about strategies at each of those levels of the public health pyramid. So if we're wondering about how can we reduce barriers to breastfeeding, we have a goal and objective around that idea. The individual level, you might develop breastfeeding plans with IHP clients. At the level, you might expand the number of health department staff that are trained as lactation consultants so they can do that work with each of the clients who have that need that they interact with. And then most broadly, you might do things like increasing the number of workplaces that have breastfeeding policies. So as you're brainstorming and searching the literature and reaching out to your colleagues, think about making sure that you're identifying strategies that tap into each of those levels of the pyramid. I have a slide here that you can use if you are looking for evidence-based strategies. Most of these are organized by different topic areas. The Community Guide to Preventive Services and Public Health, that's kind of the one that people pretty commonly go to. NACCHO's Model Practice Database has a lot of great resources. Partners and Information Access for the Public Health Workforce has some interesting stuff. AMSA, if you're thinking more mental health substance abuse, behavioral health. They have a registry of evidence-based programs that's really great. And then one of my favorite community health improvement resources is the Community Toolbox, because it just has basically an endless number of tools and ideas and resources. This particular link is to a whole set of databases that kind of catalogs best practices. So it expands this brief list of 5 bullets by 10 times. It's a big, long list of potential sites that you could visit to kind of learn about what evidence-based strategies are out there in whatever health topic you are thinking about targeting. So just some resources for you to explore as you get to this point in the process. So after you do this kind of broad look about what you might do, this piece of this is setting some priorities, because you, of course, won't be able to do everything you find. So considering what you want to tackle, questions to consider are around the strength of the evidence, and specifically, I would say, the relevance of the evidence to the community that you serve. When the evidence is produced around a community that's really different than the people you serve, there is less utility to looking at the evidence base. However, if there's good evidence that this intervention works well with the population that you serve or the type of community that you live in, that can be a really powerful sort of reason to pursue it. The reach of the strategy is another question to consider. How many people will be impacted by putting this strategy in place, and what's kind of the cost-benefit balance of that? Another question, of course, to consider is around feasibility and buy-in. Some of the work we do is in adolescent sexual health, and we know that in some communities in Michigan, it can be really a lot more challenging to put in place particular evidence-based interventions around adolescent sexual health, and that's just kind of the reality of that setting, and suggest another avenue for intervention, but it always has to be part of the conversation. Is this going to work in a setting that we're in? Are folks going to buy into it? Is it something that connects with who we are and what we believe in as a community? And I think maybe most importantly, which is why it's in bold and italics, is the perspective of the community members you hope will most benefit. We can be very, very, very well-intentioned in putting together programs, policies, strategies, resources that we think will be really beneficial to our community or the people that we serve that just don't align with where they're at or what they need. So before going forward with any strategy that you come up with, I would very much encourage you to ask the people that you hope to impact with the community what they think about it, and how they think it would work for their community, for them as individuals or as families. So please don't forget to ask. Okay. So back to the tool itself. After you've prioritized your strategies, you'll be ready to answer questions 19, 20, and 21 in the assessment tool. And those questions are, what process did you use to identify potential strategies? So there you'll just tell us, we got together and we brainstormed and we looked at the community toolbox, and I called a colleague who I knew just attended this conference, or whatever it was that you did. Response to question 20, how did you determine what strategies to prioritize? You'll tell us what you did. And we talked about, I didn't incorporate a prioritizing piece of this presentation because we did talk about it on the last presentation. So if you need to reference back to that, that would be a resource for coming up with ideas for how to prioritize. Or we can support you with that if that's something you want to talk about. But in this piece, you'll tell us what to prioritize your strategies. And then 21, will you be pursuing a promising strategy that lacks an evidence base? If so, please describe your evaluation strategy. So when you are putting in place a strategy that hasn't been tested, that's really new, it is really important to make sure it's working in the way that you expect it to work. There's plenty of examples out there in the literature of ideas that seemed really good in theory, but then in practice either didn't work or worse, were harmful. So making sure that you have a way of knowing, is this working the way that we thought that it would work? Are we keeping good tune to potential harms from this strategy, and making sure we know that those aren't happening? That's really important when you're doing something that's new. So the next piece that you'll fill in is Table 14, and you'll use it to identify the strategies that you'll use to fulfill each of your goals. So this table is organized around goals. So that first column will be, again, just copying over the goal that you already established. You'll indicate the strategy or strategies that you're using in the second column to get toward that goal. Also indicate the phase of the life course that you're targeting, the type of service, and the degree to which you're using plan to use LMCH funding to put in place the strategy. So as we talked about a couple webinars, well, we probably brought it up a couple times, that we want you to think more broadly than how you're using LMCH funds. That in some cases these strategies will be funded by LMCH, sometimes they'll be partially funded, sometimes they won't be funded by LMCH, and this is where you'll kind of make that indication of the degree to which Title V LMCH funding is being used to put the strategy into action. So once you have your strategies laid out, we have an action plan template in the LMCH tool that you can use to lay out how you're going to implement each of your strategies. So you might have a broad strategy like we are going to, we want to work with our hospitals to put baby-friendly policies in place. Of course, that strategy involves many sub-activities or action steps that will need to be completed in order to make that happen. And this is where you will, at a pretty high and broad level still, lay out what those action steps will look like, as well as the time frame for them, who's responsible, and what would be an output that would tell you, yes, we did this action step. It's completed. The reason that I think that it's important to think at this level of detail about your strategies is, again, in going back to your objectives, it will help you with time frames, it will help you with setting targets, it'll help you with what's most important to measure and for what audience. All of those sorts of questions get answered when you start to think about strategy implementation. So again, it's that back and forth idea between planning for action and figuring out how you're going to measure progress around the actions that you're taking and the goal that you want to achieve. Whole slide about action steps. About that. So the action steps, again, are the necessary steps to implement the activity. So if your strategy is complete infant feeding plans with MIHP clients, action steps might be things like adapting a feeding plan template, training staff on revisions, discussing the feeding plan during staff meetings, gathering client input on feeding plans, supporting and monitoring mothers' use of feeding plans after infant birth. So again, this isn't that minutia level of activity. We're not expecting you to complete a whole what's the 100 action steps that need to be completed. It's going to be more like what are the 5 action steps, big milestones that have to be completed in order to put this particular strategy into place. Piece of the table is timeline. That timeline field should be used to indicate who's going to support each action step and ensure each action step is complete. So if you have adapting a feeding plan template, maybe that's something you want to give yourself 2 months to do, for example, and be specific about that there. The stakeholder and responsible person table is helpful for making sure that those action steps are distributed amongst staff, maybe amongst partners, and lets you know who's responsible for getting that piece done. And then the output column, that last column, indicates you know that the action step was completed. So if you have an action step of completing a feeding plan template, the output is just that sort of simple idea that there is the feeding plan template that was approved and shared with MIHP staff as you signal that that piece of the process was completed. So, what some of your experience has been around developing action plans? What processes have you used to come up with strategies to achieve your objectives and goals? And how have you translated that into an action plan that you and your partners can follow? What tips and tricks do you have to share?
Hello, is anybody else out there?
Hi, Jill.
I feel like I'm talking way too much.
I really appreciate it.
It's good to hear. By the way, it's nice to see the little stick guys in your presentation. I like those doughboys.
Yeah.
Well, one thing that I've really noticed a lot of times is when you're developing strategies, people don't really get to the but why. A lot of times it's nice to employ a little bit of quality improvement, that process, and adding the but why process or the root cause analysis process to get to strategies that actually can be beneficial. So if any of you out there use any of those processes, might matter if you actually dig a little bit deeper into the reasons why.
Jill, so I think an example of that might be if you have this goal around increasing breastfeeding, then it's pretty important to make sure you understand why people aren't breastfeeding and what the root cause of that is before you start thinking about what to do about that. And hopefully some of your needs assessment data are helpful in that, but if you need more information, then it's great to take that pause and ask some moms that have recently had babies about their experiences with breastfeeding. What was helpful, what wasn't, what could we do to better support you and meet your needs? As well, root cause. Of course, there's other ways of thinking about root cause as well with some of the QI tools that Jill referenced, like using a fishbone diagram or using the 5 whys or force field analysis. That type of thing can be really helpful in thinking about what underlies this problem, and if that's what underlies the problem, what should we do about it? Thanks, Phil.
All right, a little QI out there.
Okay, I'm going to turn it over to Trudy to talk through the next piece of this about implementation, monitoring, and ongoing improvement.
Julia has led us through all these steps of the MAP process and the community assessment process, and as we know, it's not just a one-time deal and that we're all done with community assessment. It's really something that's a continual process, and so as you go through time, there will be new news that are emerging, new crises that happen, and that will continually change what's going on in your community, and you'll have to be continually thinking about that. So community assessment is a continual process. As you move through time, you're going to know that you're going to note what your measures of success are, how you achieved your outcomes, and you may notice that maybe you didn't quite achieve what you intended to do, or you did achieve what you intended to do. So those are all things that you want to kind of pause and think about at some point regularly to see how you're doing and to see what kinds of things that you might need to change or what things are going well so that you continue to have positive outcomes in your community. Let's see, it's hard when I didn't create the slide. Let's see. I kind of suggested this. So as you're implementing things and as you're evaluating things, if things don't work out as you thought that they might work out, it's time to take a pause and say, what else could we do differently? Maybe we need to go back to the assessment drawing board. Maybe we need to relook at our data. Maybe we need to think about things differently. Maybe our data's good, but our strategic priority was off a little bit, or maybe we still had a great strategic priority, but somehow the actionable steps that we were doing didn't quite line up with the strategy that we wanted, so we might need to make some changes. Alternatively, things could be really well, and you could say, oh, this is really great. We want to continue on this path and continue these activities that we're doing, and maybe we want to broaden them, that we're really focusing on an individual level, and now we want to look more at the community level to make even better changes. That helps you as you readjust things. You can adjust your priorities, take a look at your goals and objectives, and make those adjustments. So I'm going to talk about tying the maternal child health needs assessment to the local MCH plan, the work plan. And you might have noticed on the fiscal 18 plan that has already been turned in and approved and gone through the budget process this year, that we added in the plan where things linked to the MCH tool to give you kind of a heads up to start thinking about things in that particular way. And so what we're going to do as we move forward in 18, if you want to amend your plan because you saw something that was so awesome that we covered in the webinars, you certainly can go through the amendment process and change your plan and update your plan and update your local MCH source of fund budgets if you need to. It's not required to do that, so don't have a heart attack if you're really set where you're at in 18. That's okay too. We're just trying to let you know that there's flexibility if you want to change things around for the next fiscal year. As we plan for the following fiscal year in fiscal 19, we're really going to be taking a look at all the things that we've learned together. We've all had the same background, the same baseline of information now, so we can really, as we start to do things, we can redo things sort of collectively all together with the local MCH plan and work plan being sort of on the same page is what I'm trying to get at. One thing that we do at the state level, because of the transformation of Title V at the federal level, is that we really do this big 5-year needs assessment, and then we get to use that 5-year needs assessment for the next 5 years. So here we're doing this big needs assessment at the local level as well, and we are not expecting, I don't think it's at all realistic to expect everybody to do this kind of big needs assessment on an annual basis. Of course, as emerging issues come up or something else comes up in your community, you may need to do an update to what you have done in this year in 17, and there will be opportunity to be able to do that in the future. But what we're trying to do is move toward this 17 assessment is big needs assessment that will be in place for about 5 years. And then after 5 years, it's a good idea to really think about it on a bigger level and update that needs assessment strategically and putting pen to paper. And obviously, every year, if there's something new that comes up, there will be a place in the plan to be able to update any new assessment needs that you have. So that's the first thing that you're going to see in your fiscal 19 plan, where I said new this year in fiscal year 2019, that we're really going to be using this needs assessment that you're doing right now and completing right now in 17 to help you frame what you're going to do in the next years on your local MCH plan. One of the things you're doing in your is step 6, describing those priority strategic issues that you identified. Really took a look at what we at the state have to report at the federal level, and I thought it was kind of a good thing to do. We're doing it in the tool, but I wanted to really have you think about, are we using local MCH funds to address that priority need, yes or no? And then maybe you said, yes, we're going to use the local MCH funds in 19, but then in 20 you're like, oh, that is not working for us. I don't want to be stuck having to do that. And that's okay. That's why there's this continue column or new column. So you do have an opportunity if your assessment changes and your I'm rolling over my tongue. Your strategic issues prioritization changes, you have an opportunity to change that. So you're going to see this new table in the local MCH plan that's from the federal table and picks up on the tool that we are doing right now, that table 1. The one that you're going to have for fiscal year 19 is going to be basically the same as that you've seen in 17 and in 18 with your plan. It also will highlight how we're using those steps 7 and 8 in the work plan. So really thinking about what the data that we used, what objectives did you come up with, and then what strategies. So that's definitely using those step 7 and step 8. And as Julia said, the objectives are really hard, and so we can see some people have the objectives down pat, and you even see that some people have some struggles, and you may even see then as you're going to do your final reporting for the first time on the work plan for fiscal 17, that you might say, oh my gosh, what exactly was I thinking I was going to measure. So you've got an opportunity to think about what you've done in the past and how you might change that in the future. So the work plan is going to look really the same. We're going to be using the national performance measures, the state performance measures that you identified through your needs assessment and you want to do with local MCH funds. If the performance measures aren't applicable to you or you have a different local identified need based on your needs assessment, you'll be able to still identify what that need is. I wanted to also clarify some activities and timelines. The funding that we had for this particular project for the MCH needs assessment of $15,000 is from January 1st through September 30th, 2017. We've had a number of people emailing us wondering when, when can they their activities. So all your activities that you're doing for this, all the billable activities have to be completed by September 30th of 2017. And we're going to have you with your final FSR not only submit your local MCH report as you have done every year, but we're going to have you upload the full MCH completed needs assessment tool. And so you've been doing the tool all along, so we're not asking you to do something new. It's just putting it all together into one document, and you'll update that. So you've already got steps 1 through 3 done that we're doing in February, and you have updated your vision statement, added some things that, so you might want to, you may have tweaked it, and that would be great. Or it might have been awesome as it was, so that's okay too. Steps 4 and 5 we're due in June, and we're just getting feedback, working on our feedback right now and getting that to you as soon as we're done with that. And then step 6 is due tomorrow. I can't believe August 11th. Tomorrow, August 11th. And then steps 7 and 8 are due mid-September. And we'll give you some feedback on that. Then that way, if you want to tweak any part of your tool, you can do that. And then with your final FSR, you'll get the completed needs assessment tool uploaded with the final FSR with your finance person. Those are due at the end of, or at mid-December, but some departments are, they get those, they get their final FSRs in much before December, so we'll be getting you can be looking for your report, your documentation soon, and you'll be able to upload both of those things. Are any other questions about how we're going to be using the local MCH plan in the future, or what the activities and timelines are? I'm thinking about the fiscal 19 plan, and this is from a previous question, and we actually addressed this in a previous webinar, but I want to re-emphasize it, and that is, what if what I'm using I traditionally use my local MCH funds for doesn't bubble up as a strategic priority in my local MCH needs assessment because you've asked us to be really broad? So, okay. It might be it didn't bubble up because you have the resources of the local MCH funding that has allowed you to have pretty decent outcomes, and so things are moving along in a positive, progressive way. But if you to remove those local MCH funds, that could really put your particular outcome in jeopardy. And so recognize that there is a place in the plan in 19, so if it didn't bubble up as a strategic issue, we actually have a couple of separate questions that specifically address that, and we will ask you to tell what that is. We actually have 2 questions, so if your agency elected to use the LMCH funds on a different priority not identified in the fiscal 17 needs assessment, we'll ask you to describe your priority issue and the data that drives the issue and your rationale for selecting the priority. So just to reiterate that you don't have to panic that it didn't bubble up at the top of a list on the MCH needs assessment. There's still opportunity if your community needs point in a different direction. Rob said we're clear as mud, so.
Is it clear as mud?
I hope it's clear, a little clearer than mud, but working to clear up any confusion or questions or concerns.
Ask, because I bet you somebody else has the same question.
So your 19 work due again, like was it March that it was due for 18 this year? I can't remember when that was due.
It was. We're going to try to maintain the same timeline.
Okay.
To bump it up earlier, but we said that was unrealistic.
Okay.
In our last couple minutes, we're just going to give a few reminders of things you've seen before here. So we have our SharePoint site that has webinar recordings. It has the slides from the webinar. It has the tool, additional resources, contact information. So if you need something, that's a great place to check to see if it has the information you need and are looking for. Also, if you need any help at all, you are invited and encouraged to contact Lauren to reach our team here at MPHI, as well as Trudy and Robin are always there to support you and meet your needs. So please contact us as you have questions. If you need help thinking through something, want to bounce ideas off of us, that's what we're here for, and we're more than happy to support you. Again, just our final steps. Step 6 will be submitted tomorrow. Again, just like in the past, if you're not quite there yet, if you have a meeting that's happening next week and you want to wait till that to kind of finalize things, no worries. Just contact us and let us know what your circumstances are. But generally, August 11th is the deadline for Step 6. And as Trudy said, 7 and 8 are due September 15th, with the final tool revision due actually uploaded through to the LMCH as you do your other LMCH deliverables through MDHHS on September 15th. All right. And we covered the feedback forms as well, that we're working on those now, and we'll get them back to you just as soon as we can. It's really delightful to see all the work that you've done, really exciting, and makes me proud to be part of this great public health system that we have in Michigan. So thanks for allowing us to take a peek into the good work that you're doing in your communities. Any questions before we close out today? Okay. Have a really great afternoon, everyone, and we look forward to hopefully hearing from you very soon. Take care.
Thanks. Bye. Bye, Trudy.
Bye.